The World Health Organization is launching a $100 million campaign to tackle the worst Ebola outbreak in history.
We now turn to Paul Yee at the News Center for the latest developments. Paul, the virus has claimed over 730 lives since it first broke out in West Africa earlier this year. How are they hoping this new plan will contain the disease?
Well, the WHO says the funding will go towards deploying hundreds of medical personnel to the hardest hit countries. That's Sierra Leone, Guinea, and Liberia. Health authorities worldwide are watching the unprecedented Ebola epidemic very closely over fears it could rapidly spread across the globe. Our Connie Lee has more.
Health authorities in West Africa are struggling to contain a deadly Ebola outbreak.
To look over this fence right behind you now and look at the patients, and you know that their chances are very small, and it's horrible.
More than 700 people, including dozens of health workers, have died so far from this year's outbreak, and there are currently more than 1,300 others who are confirmed to have the virus. Sierra Leone, one of the hardest hit countries, is currently in a state of emergency, and health officials have begun to quarantine certain areas. The rapid spread of the virus is putting a strain on the nation.
Already we had a very inadequate health workforce, and we don't have enough specialists in country as far as medical doctors and even specialist nurses are concerned.
That concern has spread throughout the world. The World Health Organization said Thursday that it is launching a $100 million response plan to combat Ebola in West Africa.
The plan includes, identifies a whole range of medical personnel required to help support the response to the outbreak.
Meanwhile, the U.S. Centers for Disease Control and Prevention has advised Americans to avoid non-essential travel to Sierra Leone, Guinea, and Liberia. And according to CNN and USA Today, the U.S. government plans to test an experimental Ebola vaccine as early as September. There is currently no cure or vaccine for Ebola, and the fatality rate of the current outbreak stands at about 60%. Connie Lee, Arirang News.